Hello and welcome. We're pleased to have people joining from all over the world today to take part in a conversation about treatment and research on pain in MS, one of the most challenging symptoms that many people experience. We also want to highlight the vital work of the International Progressive MS Alliance in accelerating the development of new life-changing treatments for progressive MS. During our time together today, we'll be answering questions that people have provided from throughout the world on how to better manage MS pain and what research advances are being made in understanding and treating pain. My name is Corey Turner. I'm joining you today from Toronto, Ontario in Canada. I've been involved with the MS Society of Canada for many years, serving as a board member on the MS Scientific Research Foundation and as a lay member of the Medical Advisory Council. I strive to be a strong advocate for those affected by MS everywhere, and currently serve on the People Affected by MS Engagement Coordination Team as part of the International Progressive MS Alliance. Professionally, I'm the president of a company called Spicers Canada, which is a distributor in 3 channels: packaging, paper and print, and graphic solutions. And most important for today, I was diagnosed with MS in 2005. I understand the importance for those that are affected by MS and their ability to manage pain, and the urgent need to find better solutions through research. And I would like to thank all of you for the questions sent in advance regarding pain in MS prior to the event. We had comments from more than 20 countries, and we'll do our best to cover the topics you have asked about. In a minute, I'll introduce you to the terrific panel of experts, but first, I'd like to recognize our webcast sponsors and share some information about the International Progressive MS Alliance. We are so grateful for the generous support of our sponsor, Sanofi. Thank you so much for helping make this important webcast possible. The Alliance is an unprecedented global collaboration to end progressive MS. It includes 19 MS organizations, hundreds of researchers and health professionals, the pharmaceutical industry, companies, foundation donors, and people affected by MS. In short, the Alliance has brought the world together to solve progressive MS. To date, the Alliance has invested over 24 million euro in research with an overall commitment of 60 million euro through 2025. If you are watching this webcast, you likely know that ending progressive multiple sclerosis is an urgent and unmet need. With me today are leading MS experts who are working to help people with MS live better lives today and help fuel research to develop new life-changing solutions for tomorrow. Dr. Dawn Eadie is a psychologist and holds the Nancy and Buster Alvord Endowed Professorship in MS Research in the Department of Rehabilitation Medicine at the University of Washington in the United States. She conducts clinical trials evaluating non-pharmacological interventions for chronic pain, fatigue, and other symptoms affecting people with MS. Dr. Jaume Sastre Garriga is a neurologist at the Neuroimmunology and MS Center of Catalonia in Barcelona, Spain. He has served in several leadership positions in MS treatment and research internationally and published over 100 papers. His research interests include neural rehabilitation with a particular focus on progressive MS. Dr. Kathy Zakowski is the Associate Vice President for Research at the National MS Society in the United States. She manages the Society's research portfolio on clinical and rehabilitation care. Prior to being at the Society, she was at Johns Hopkins School of Medicine as a researcher focused on neuroscience and as a clinician providing occupational therapy to individuals with multiple sclerosis. We'll start today's discussion on understanding the basic regarding pain in MS. We will then discuss treatment options and finally research efforts to find new and better solutions. Dr. Sastre Garriga, pain in MS is not just one thing. People with MS experience different kinds of pain. Can you describe the various kinds of pain?
Thank you very much. Thank you very much for the invitation being here. I think we could say that we have 2 major sources of pain in people with multiple sclerosis. think first we could have pain directly arising from an MS lesion, which may be affecting the somatosensory systems. This would be the neuropathic pain, which admittedly can come in different shapes and sizes. Typically, what we call neuropathic pain refers to pain usually in a limb or most typically in the lower limbs, which is of a chronic nature but may have fluctuations and can be described mostly as a very intense discomfort, an ache rather than pain, sometimes referred as like intense coldness in the limb or electricity, low burning, but descriptions can be very different. Other types of neuropathic pain that are also very relevant would be the, let's say, paroxysmal, lancinating, and very disturbing trigeminal neuralgia, which is an intermittent high-intensity pain in one side of the face. And other types of more specific painful syndromes like, for instance, the Lermite sign, which was a famous neurologist, which is an electricity feeling down to the trunk and legs when flexioning your neck. And then there are other types of pain like the pain in acute episodes of optic neuritis. This is one type of pain, what we call the neuropathic pain. This is arising from lesions in the central nervous system, directly from those lesions. But there's another main source of pain, which is also very relevant, which is the musculoskeletal pain from the musculoskeletal system, of course. First and foremost, I would say this is pain related to spasms or spasticity, as this is affecting muscular and bony structures that may induce pain acutely or chronically due to the spasms or due to the spasticity more in a chronic way. Other types of pain include all pain due to misuse of joints or muscles because of disrupted movement or positioning patterns because of weakness of the limbs or trunk. Back pain, in this case, is a typical one.
Excellent. And just, we know that pain occurs in different frequency for people. So as a follow-up question, can you address that aspect of pain?
Yes, this is very relevant as well, but I have already mentioned that en passant in my previous answer, because these different types of pain are also associated with typical frequencies and timelines, let's say. So for instance, some types of pain tend to be acute, like the pain in an optic neuritis or myelitis. Other usually present in paroxysms, so in bursts, as the pain in trigeminal neuralgia, typically like thunder or Lermites. And some others tend to present more chronically, like the neuropathic pain, as mentioned before, the usual pain affecting a limb or usually the lower limbs. And most of the musculoskeletal pain, except the spasms, related pain. This, as I say, the musculoskeletal pain tend to be chronic as well.
Yeah. Well, thank you for expanding on that. Dr. Eadie, pain is also connected to other symptoms people are experiencing, such as depression. Can you talk about the connection between pain and other symptoms that may present themselves?
Yes, and again, thank you for having me here today to talk about this very important topic. So yes, pain absolutely interacts with and exacerbates other symptoms. We know that pain, for example, has adverse or negative impacts on other things people with MS experience. Pain interferes with daily activities, the ability to do what you want to do during your day. It tends to cause people to be less physically active, less socially active. People with pain tend to have worse sleep. And we know in people with MS it increases fatigue, or they go together. People with pain are at greater risk for having mental health conditions like depression, as you mentioned, as well as anxiety. And two other areas I'd like to mention: pain can have a negative effect on your thinking. We know that people with MS some experience changes in their cognition, their ability to attend, concentrate, their speed of thinking, and their memory. And studies have shown that chronic pain can also affect those abilities. And one other area is that they have a greater risk of falls. So pain has many adverse impacts, but I also want to point out that pain, it rarely occurs in isolation. It often goes along with the sleep problems, fatigue, mood, and cognitive changes, and they all can make one another worse. And one last point I'd like to make about this is that, which has relevance to treatment, is we know that pain is complex with many effects, but we also know that pain is processed in the brain in terms of how pain sorts and characterizes pain signals, triggers responses to pain, and give meaning to pain. And many of these areas where pain is processed in the brain are also involved in other conditions and symptoms such as depression, anxiety, and so forth. And so we know that we can intervene by addressing some of these other effects of pain in addition to pain itself, because much of it's very interrelated.
Yeah, thank you. That was terrific. And both in your research and your clinical practice, you've developed some self-management strategies that people can use that are effective in helping to relieve this pain. Can you share some of that with our audience?
Yeah. And by self-management, we simply mean that the person with pain does the day-to-day management of their painful condition and its effects. So it's really stuff people can do, or strategies people can do to decrease their pain and its negative impact on their lives. And many of the strategies that we focus on have to do with how people think and respond to pain. Some of these you might have heard of. They're called cognitive behavioral or mindfulness-based strategies. And what they all have in common is that they treat pain by counteracting or calming the brain and body's natural response to pain. If you think about it, pain plays an adaptive role in an acute situation. It puts our bodies on high alert, our brains on high alert, that we need to do something to, get out of the situation. And that response works well when someone has an acute pain, like a broken bone. However, when the brain is continuously kind of warning you that you're in pain or that there's danger because of pain, we need to look for strategies to counteract that. And so a lot of these strategies have to do with kind of calming the stress response, calming your nervous system, using things like relaxation practices, meditation, for some prayer is helpful, or calming thoughts and activities. They also involve learning how to identify and challenge and change stressful or unhelpful thoughts that can increase the stress response, which then in turn increases pain. And then also helping people with MS to learn how to pace and not overdo or underdo activity. Because we know if you do too much on a good day, it can exacerbate your pain. And similarly, responding to pain by being inactive is also not helpful. And kind of, I think the other thing to think about is we also want to treat things like sleep, depression, anxiety. Treating those, we believe, can also improve pain in people with MS. So, and kind of my parting comment in terms of this topic of treatment, behavioral strategies in particular, is that there's more and more there's evidence in people in other populations that don't have pain that mindfulness meditation and these cognitive behavioral strategies change how the brain perceives and processes pain. Although there's still a lot to learn about how these changes translate to how people with MS manage pain.
And just with so many multiple solutions available to us, how do we incorporate that? Can you give an example of how we can incorporate those into a sort of a multi-pronged or coordinated approach?
Yeah, I think chronic pain is typically best treated through a combination, as you suggest, tailored to a specific patient. And oftentimes it includes, multiple professionals, the neurologist, rehab team, psychologist, mental health expert working together with a person with pain. And it might include things like medication, behavioral strategies, like some of the self-management strategies I've mentioned, and appropriate physical activity. So, for example, someone with progressive MS might benefit from learning and practicing on a regular basis relaxation or mindfulness learning how to identify unhelpful stressors that really amp up their pain, learning to pace themselves, and then participating in occupational or physical therapy to learn appropriate ways to exercise, to move, and to go about their lives with pain. And so, so oftentimes it's a combination. The good news is there's a lot of different things to try.
Yeah, and expanding upon this, Dr. Zakowski, more specifically around exercise and physical or occupational therapy, how are those solutions for pain?
Well, thank you. That's a really important question. And again, thank you for inviting me to be part of this. It is a really important symptom that we need to focus on. So to just address exercise to start with. So, exercise is one way to address weakness that may be contributing to pain. So getting stronger can relieve tension and improve your overall alignment. But just as Dawn said, exercise can also exacerbate pain in some cases. So while I would encourage everyone to exercise, a person with MS who has pain should really seek an evaluation by a physical therapist and an occupational therapist to just see if exercise is a safe solution. And so kind of differentiating between these two rehab professionals, physical therapy will evaluate you and may be able to identify the injured tissue, meaning kind of bone, muscle, tendon, this musculoskeletal area that was mentioned earlier, and recommend treatment to promote healing and reduce stress to that injured area. But in MS, not all pain is associated with injury to the musculoskeletal system. So a PT can recommend exercises that are safe for you and determine if additional tests are needed to identify the cause of pain. We talk about occupational therapy, that this profession kind of strives to improve a person's functional ability. So an occupational therapist will evaluate and focus on function and how pain is interfering with your function and train you in strategies to address this. They will also work to integrate and reinforce treatment goals from other disciplines. So for example, a person with pain may learn relaxation techniques from a psychologist and physical exercises from their physical therapist, but they may have difficulty integrating these interventions into their habits and their daily routines in a consistent and effective way. So an occupational therapist can kind of help bring these treatments together so the person really gets the most optimal relief and can stay as functional as possible.
Thank you so much. Dr. Sastre-Garriga, just shifting a little bit, there are some drugs that are available for treating pain in MS. Can you describe some of these and their effectiveness?
This is a very, very relevant question as well. Obviously, as I mentioned before, there are different types of pain. So drugs most commonly used for MS pain will depend on the type of pain syndrome that we are facing in each particular person. So for instance, I go through some of them. For trigeminal neuralgia, therapy tends to start with carbamazepine or oxcarbazepine. That would be the first line. And if this is not working, we could change or maybe add other types of drugs like baclofen, phenytoin, or lamotrigine. If this pharmacological approach is not working, then we could go to interventional therapy with gamma knife or with vascular decompression. But I would tend to say this is really just in very extreme and luckily in very infrequent cases. For instance, in the case of Lhermitte pain, which is this sense of electricity going down from your neck to your limbs when you flex your head, usually pharmacological therapy is usually not necessary because this problem will tend to subside rapidly, or usually is not very disrupting. However, in any case, a steroid therapy would work to decrease the lesion-related inflammation. This is usually a cervical core lesion, which is causing the myelitis attack, and will help relieve this symptom. And this would be exactly the same as for pain related to episodes of optic neuritis, in which case you can also use non-steroidal anti-inflammatory drugs for sure. With regards to another very common type of pain, which is pain coming from spasms and spasticity, this pain will tend to improve with drugs targeting the spasticity phenomenon, like most typically used as first line are baclofen or tizanidine. We could also use gabapentin, clonazepam. Usually we use this before going to bed, or in cases of very focal spasticity, we could use botulinum toxin injections in the affected muscles. Talking about muscles, obviously musculoskeletal pain may be treated with short bursts of non-steroidal anti-inflammatory drugs if needed, and use of other drugs, just to finish, like opioids for non-responsive pain should be done in well-controlled settings. And what we tend to do in these particular cases, we refer patients to a specialized pain clinics, so to avoid misuse of these very powerful, on the other hand, drugs.
And just expanding on the risk associated with that, just if you could just expand on that a little bit for those concerned about interactions with other drugs or side effects, just some comments that would be helpful.
Yes, this is very relevant as well. Some of these drugs are central nervous system depressants, so may induce some sleepiness, and in some cases will be inducing ataxia, which is the imbalance when walking, and gait difficulties. And also particularly because some others may induce, or there are some that could induce both things at a time, weakness. This is particularly the case for the antispastic drugs. I think in all these side effects should be weighed against the benefits. But for instance, in the particular case of trigeminal neuralgia, which is this very painful strikes of pain on one side of the face, I tend myself to recommend energetic therapy and maintenance till no sign of pain is present, because it tends to come back when you try to taper in this case, particularly carbamazepine. So I think it's important to try and tolerate what side effects may come in terms of sleepiness or a bit of imbalance. In chronic pain, this is a bit more difficult as well, because this compromise that should be reached between effectiveness and tolerability, because this is mostly an issue of tolerability, not of safety, of course. So I think this balance between tolerability and effectiveness, it's very important to strike the right point, because it's usually a therapy that we shall maintain over time. As I mentioned, because all of this is tolerability, again, I repeat, as I mentioned before, there are no major safety issues to be expected. But I think appropriate management should be in place to avoid overuse or misuse of these drugs. Just a final sentence saying that obviously most interactions will be caused by using other central nervous system depressants like benzodiazepines or other types of drugs that also may induce sleepiness, drowsiness, and so on.
Thank you so much. It was excellent. One other area I think that people would like us to cover is the use of complementary or alternative therapies to address pain, including the use of marijuana. Are there effective approaches that people can consider, Dr. Eadie?
Yes, absolutely. So, we know, for example, that certain alternative treatments can be beneficial. And for example, one of those is what I'll call self-hypnosis training, teaching people how to induce a state of self-hypnosis that they can use in their day-to-day life and practice at home. That has been shown to reduce pain and pain interference in people with MS, including progressive MS. that's just one example. We also know that other lifestyle interventions, such as yoga, and we think, although there's not evidence really yet, that healthy eating and healthy diet can also potentially be beneficial. So those are just a few examples. And a lot of it, it really comes down to lifestyle, changing your lifestyle in terms of activity, using things like self-hypnosis, et cetera. In terms of marijuana, that's a complex question. There's definitely good evidence that research grade medical marijuana is beneficial for relieving MS-related pain and spasticity. However, there can also be adverse effects, including impairments or difficulties with thinking that can be exacerbated, such as with memory, attention, and new learning. There's always the potential risk from contaminants, depending on where a person is getting their cannabis or marijuana, inaccurate labeling, and just the challenge that there's not standardized formulas for these. In the US, we know that cannabis products obtained from dispensaries or other people, that's where most people get their cannabis. And a recent study done right before the pandemic by my colleague, Dr. Tiffany Braley, in December to early January of 2019-2020 of over 1,000 adults with MS from across the United States found that 42% reported using cannabis or cannabis products in the past year for MS symptoms. However, only 18% of those were using it had discussed it with their healthcare provider. So most people are getting their information about the use of cannabis from family or friends, or their own Googling or internet searches. So, I really encourage people with MS and pain who want more information about, is medical marijuana or cannabis a reasonable option for managing pain, to really talk with their providers who know their MS, and to look at the resources provided on this topic. And we have I think a helpful guide for people about the effectiveness, safety, and drug interactions of medical marijuana that you'll be able to find in our resources as part of this webcast.
Thank you so much. Your comments have been just very valuable. Dr. Zakowski, the International Progressive MS Alliance admirably is calling for more research on pain and MS. What's led to this worldwide call to action?
Yeah, I'm happy to talk about that. So a few years ago, the Progressive Alliance hosted a World Congress, which is just a large meeting that had a focus, though, on rehabilitation and symptom management, where there were over 200 researchers and supporters from 16 countries that participated. And the result was a new perspective and resolve to find solutions that will improve the quality of life for people living with progressive MS. So from this, an expert group was formed to highlight common symptoms important to people with progressive MS, and to stimulate the design and implementation of high quality studies focused on symptom management and rehabilitation. And one of the symptoms that the group found to be in need of research was pain. And we reported that pain is a prevalent, disabling, and persistent symptom associated with MS. And I thought it was important to even mention that in one prospective study, progressive MS was associated with a greater risk for disruptive pain relative to relapsing MS. So we also found that pain receives limited research funds. So this group highlighted a need for increased research investment from the Alliance and other financiers into the studies of symptom management and specifically pain.
Yeah, and there's this new research initiative, and we've talked a lot about pain, but it's also aimed at some of the most challenging symptoms of MS, not only for pain but fatigue and cognitive issues and mobility. Just a couple of more comments just around that, because I think that's important to make a comment on as well.
Yeah, the Alliance is creating a pipeline to fund research in these 4 symptom areas: cognition, fatigue, pain, and mobility and upper extremity function. But one feature of this pipeline is that it focuses first on finding research that's innovative and encourages researchers to develop a network of experts. And that this network would then be important for designing a clinical trial to test an intervention that addresses one of these symptoms. And finally, the pipeline and it won't stop there. It ultimately, the results of the clinical trial need to be implemented so people with MS can benefit. So the final step in the pipeline is focused on this idea of implementation. So it's important to recognize that all this work takes time, and that we're focusing on 4 symptoms with the awareness that there are lots of symptoms that are really critical to people with MS, and that it's important that we embark on this pipeline as soon as possible. And the Alliance, to their credit, is planning to begin this work in 2023. So the time is really right to move forward with this. Thanks for asking.
Thank you so much. I know we're coming to the end of our time. As somebody that's affected by MS, I'm incredibly thankful to this panel for all of the comments that you've made. I want to just give each of you just a last chance, just some parting advice to our viewers. What's the one thing that someone with MS could do today to better manage pain in their lives? So I'll start with you, Dr. Eadie. What's your advice?
I recommend that people try something today. If you have pain, go ahead and try something. There's many things you can do without having to see a healthcare provider, and I've described some of those. And you can find some self-help tools at mymstoolkit.com, which we'll make available to you, which was developed specifically by people with pain to use to manage, or people with MS to manage their pain. So, I think it's really a matter of trying different things out and recognizing that you need to adapt new habits and regular practices if these strategies are going to help you, but they will help you if you practice them.
Thank you. Dr. Sastry-Garriga, what could you add to Dr. Eadie's comments?
Well, I would add 2 things. Maybe one is just a repetition of what Dr. Eadie said. First one, I think I mentioned before, we should be ready to try to accept a balance between side effects and effectiveness of drugs. I think we need to minimize side effects and maximize effectiveness, but we'll never reach 100 versus 0. So we need to be ready to sort of do a trade with these 2 factors. And the second one would be that, and I think it goes very well along the lines of what Professor Ede said, we must also, not just forgetting about drugs, we must also focus on all other aspects that may exacerbate pain and try to minimize these other factors. This is as much relevant as any drug that you could take.
Thank you so much. And Dr. Zakowski, your advice for the group that's watching today.
I completely agree with what has been said so far. I would add 2 things. One, I really encourage you to be active. Exercise is one thing, but even just being active, whatever is comfortable to you, but really try to stay active every day. And lastly, I wanted to be sure that you recognize the importance of accessing your social support group. So it's critical. It can help improve a person's quality of life. So don't underestimate this idea of having just support figures around.
Thank you so much. To our viewers, today we addressed some of the leading questions regarding treatment and research in MS pain. At the very end of the webcast, you will note a listing of online resources where you can find even more information on MS research and strategies to manage this extremely challenging symptom. You may want to take a screenshot of these resources. Also, MSIF will be posting these in the chat and have them available following the webcast. As I hope you experienced with today's panelists, the Alliance has the best people in the world working to find solutions to the challenge that people that have progressive MS are facing. The Alliance continues to inspire hope and make progress through funding research that can improve people's lives. And still, we must and will do more to end progressive MS. Thank you to our panel of experts, Dr. Eadie, Dr. Sastry-Garriga, and Dr. Zakowski. You did an amazing job. Thank you so much. And thanks to all of you watching for joining us today on this very important topic. Please stay connected to the Alliance through our regular webcasts and your MS organization. And please share the work that's being done by the Alliance with others. But we need everyone to be part of this effort. Together, we will be stronger. We are stronger together than progressive MS. So thank you for today. I really appreciate everybody's participation. Thank you.